Hello everybody, Dr. Justin McCormick here. So I came across an article that's titled "The Missing Link in the Treatment of Lumbar Disc Syndromes." And I like this article because 90 to 100% of the patients that I see in my office, they've tried going to other clinicians and they have gotten little to no relief or response with either herniated discs, slip discs, spinal stenosis, whatever it is that you have. So I like this article because from the first paragraph of me reading it, it says, "So what is the number one reason why a treatment plan fails to provide the results that I desire with the disc patient, and what am I missing?" So basically this article talks about a phenomenon that we call the centralization phenomenon. What that is during your initial exam, you're trying to find a position, an activity, some sort of angle that the patient can go into where they have a relief of pain. Well, what is centralization? Centralization is where pain goes from a lateral aspect or peripheral, maybe it's radiating down the arm, maybe down the leg, and what happens is when a patient moves or does a certain activity, that pain will centralize. It'll come back towards the center, away from the legs, the arms, and it may even minimize. So during my initial exam, I'm trying to find out where is that patient's position the best? Where can they lean to? What activity do they do where it relieves that pain? So the first thing I'm trying to find out is how can we make that patient more comfortable? And then how can we expand on that so that we can give them the relief that they need? So centralization is one of the main things that I'm looking for. But he also goes on to say, in the second page here, he says, "But there is one missing link in the centralization protocol that I see doctors fail to use in their offices. They forget the second part of the centralization phenomenon, which is centralizing the pain, but also gaining an increase in their patient's active range of motion." So most clinicians will do some sort of passive therapy, whether that's drugs or a certain treatment protocol that does give them some relief, but it's not long lasting, it's very short-lived. So we've implemented also a therapeutic approach. So not only when you come into my office are we looking for what treatment do you need, but also what's the best rehabilitation approach to maintain that in the long term. So what I'm going to look for when I see you guys on your first exam, if you choose to take advantage of our free trial visit, is where does that position that's the best for you, that minimizes the pain, how can we expand on that so we can correct that problem? And then what's the best rehab so that this problem doesn't come back again? Like I said, 90 to 100% of the patients that I see have had little to no success with their prior treatments. It's obviously why they've came to see me. The reason that we've had in our office a greater than an 80% success is because, again, not only do we look for that centralization phenomenon, but we also look for the best rehabilitation approach to correct core stability and active range of motion. That's why we get greater than 80% and 90 to 100% of their prior treatment has failed. So if you want more information on our program, if you want to come in and take advantage of our free trial visit option, you'll get your first exam covered, your first consultation with me covered, and then if you're a good candidate for spinal decompression, whether you have slip disc, herniated disc, bulging disc, spinal stenosis, whatever condition you have, if you're a good candidate for our treatment program, we will go ahead and also give you your first treatment for free in our office. So call our office, 425-379-6004. Go to our website, www.spinedecompressioncenter.com. Ask for Stephanie, ask for Monica, whoever answers the phone. Let them know you want that 2 free trial visit option, and we'll be happy to set that up for you. I hope to see you soon and take care of those back problems that you have.